So the way the standard of care is written for Lyme is that, and this is a big debate in the medical community, whether or not there is a chronic Lyme condition.
Mm-hmm.
So the standard of care is 21 days of doxycycline, and if you're not cured or feeling better, they consider you to be, post Lyme, and it's sort of like you just basically kind of have to deal with the symptoms.
Mm-hmm.
And so that's where the rheumatology came in, pain management, and all these other providers basically saying we're going to treat, sort of these issues.
Meaning the symptoms
Yes,
and not really the root cause of the Lyme itself.
correct.
Right. So how'd that make you feel?
I felt really horrible. Like, I was a pretty young guy at that point.
Right.
I think I was 29 years old when I got diagnosed, and they were basically telling me, look, you're just going to have to deal with it.
Mm-hmm.
And I did not accept that. So I fought hard and did my homework and became an advocate for myself. And eventually I was able to find a doctor outside of the medical establishment that was willing to give Lyme the treatment that it usually requires.
Mm-hmm. A board-certified physician, right?
Yeah, he was an old, basically retired physician,
Mm-hmm.
old school doctor, had ran Milwaukee County Hospital in the 50s and 60s,
Mm-hmm.
and he actually ended up writing books about Lyme.
No kidding.
And so he dedicated his later life to, sort of correcting the injustices of Lyme in the mainstream medical system.
Mm-hmm.
And he helped a lot of people, and a lot of the advocacy that I do to try to help patients is because Dr. Weisbrunn had told me you need to carry on this legacy and give back.
Mm-hmm.
Try to help as many people as you can.
So how did you find him?
I found him. It was a support group. There's a pretty active Lyme community in Wisconsin,
Mm-hmm.
and so they exchange ideas about doctors and different treatments that people have had success.
Mm-hmm.
And so it was. I was very fortunate to have met this woman in my group, had some success with this doctor.
Mm-hmm. And so you meet him. He accepted your call for help. So what happened? What was the course of interaction with him?
Well, I mean, it was basically like shotgun therapy, as he called it. They put a PICC line in my superior vena cava, going right to the heart, and for about 2 years I had very aggressive antibiotics, all sorts of different medicines, Anti-Malarials, antivirals.
So definitely more than 21 days.
Yeah, absolutely.
Mm-hmm.
I mean, we're talking doses of antibiotics that the hospital pharmacists wouldn't even administer. Because this doctor believed, either you were going to kill the disease or the medicine may or may not kill you.
Yeah, if the disease itself doesn't.
Right.
Yeah, yeah. So 2 years.
2 years, yeah.
Wow. And so at the end of the 2 years, what happens then? Are you aware that you're healed or cured, if you even want to use that term, or were there measurements that helped, like a metric of some sort that helped, define that for you? How did that come about?
So, yeah, after the 2 years, I mean, there's some objective clinical tests with, it's called PCR analysis.
Mm-hmm.
It's basically looking at genetic fragments of the different pathogens associated with Lyme.
Mm-hmm.
I had that done a couple times, and after the 2 years of treatment, I didn't have a lot of the active pathogens in my system.
Mm-hmm.
But I think really I didn't start feeling better until I started cleansing and getting a lot of those toxic medicines out of my system.
Right.
So there was a lot of steam rooms. I really engaged in hot yoga, which was really helpful. Juicing, all the things that I needed to do to prime my body to really heal itself on its own.
So you just mentioned something that I happen to be a big believer in, is the body can take care of itself, right?
Yeah.
So you kind of figure out a way to set the stage for your body to kind of carry you through then, after that massive 2-year dosing of these noxious, toxic drugs trying to kill what's killing you, essentially, and just bringing you back to a new sense of life.
Yeah, that's absolutely.
Now, is there anything else that I haven't touched on that you think is important for maybe somebody who's watching right now to know about what happened with your journey, and not just the disease process, but relating to people, or how you would relate to people that would be important to share?
Well, I think that I think it's important to keep in mind that there is hope. There is hope that you can recover. It's going to be probably a long journey, and it's really dependent on how long you have this stuff in your system before you start to aggressively treat it. People that get infected by a tick-borne illness and get treatment right away, most of them have no problems at all. The challenge is when it sits in your nervous system and does all this damage to your organs, for 5, 6, 7, 8 years. Those are the people that are going to have a much longer recovery time.
Right.
But I do think that one of the biggest things that people need to be aware of is they need to have intellectual curiosity to kind of do homework and research on their own, because you're not necessarily going to get straight answers out of the establishment medical system. Doctors and medical providers have a very narrowly defined standard of care, and they do not really want to give Lyme patients the kind of treatment that many of them need.
Right. Especially if it's been chronic, right?
Yes.
Yeah. Okay.
And that's part of the issue. Is there's a lot of debate whether or not chronic Lyme disease is for real or not. And I'm sure you've seen it in your practice dealing with patients that may not be recovering.
Right. Well, like you said, I think there's just so much fogginess and gray about it, and you're literally walking through not knowing where you're going until you find something you can touch and at least give you some sort of a reference point from which for you to work. So I know you're a big advocate now. What is that like? You mentioned that the physician who saved you, who's no longer with us, right? He's since passed away.
He passed away actually one day before I was going to be going to my discharge appointment, which is just very strange timing.
Yeah. So as an advocate, you're kind of the voice now, so to speak, his voice, if not your own voice as well. In addition to the intellectual element of curiosity, for somebody who's maybe been there for a while, so to speak, as you were, how can they turn it around for themselves? Where would they go? Who do they talk to? What kind of questions should they be asking? Maybe if we can help give them a reference point from which to work, that might give them some traction in their own recovery.
Sure. Well, I think you wanna first try to start out, with your trusted physician or medical provider to try to get some answers.